So we're going to review palpation, FP and FR, of the pronator quadratus, its clinical importance, some things we find in practice here at the Functional Range System headquarters, and how we address any type of closing angle pain or types of closing angle pain we may find in the wrist. So a common thing with the wrist is what we call ulnar impaction syndrome, which is basically described as impaction of the distal ulna onto the carpal bones. The pronator quadratus is a very deep structure, one of the deepest structures, and is actually just an extension of that anterior aspect of the wrist joint capsule itself. So the pronator quadratus runs transversely across the wrist, and there's two heads, a superficial head and a deep head. The superficial head runs more transversely, whereas the deep head has a slightly more oblique portion. The importance of the pronator quadratus, based on the literature, it actually may act in a way that as you load the wrist or pronate the wrist, it'll actually have a force where it can pull the ulna proximally and medially to clear that space on that medial side, and the space between the ulna and the carpal bones. So if we're going to palpate and assess the pronator quadratus, we have to make sure that we're getting deep to the structures of the anterior forearm. So to do that, you can have the client just make a fist, patient make a fist, and a slight ulnar deviation here. And from here, you should be able to find the flexor carpi ulnaris. So that's going to be the first tendinous structure on the medial side of the forearm. If we go any more lateral, we're going to be pushed out by all those tendons. So we need to stay on the medial aspect, or the medial side of the flexor carpi ulnaris. So once we're on that medial side, we can sink just deep or roll onto that medial side of the ulna, staying on the inside of those tendons. And then we can just wrap the thumb around and hook onto the anterior side of the ulna. From here, we can assess, be a smaller window of opportunity to assess, where we can assess that tissue as we supinate through the wrist, assessing for any mechanical tension, any aberrant tension, or perhaps getting pushed out prematurely, which may indicate neurological tension of that pronator quadratus. If that person does have that type of closing angle pain or ulnar impaction syndrome, and then we assess and treat the pronator quadratus with those FR inputs, we should see an objective improvement in that range of motion, as well as the reduction in symptoms in that medial side of the wrist.